Hi, I'm Joe Calderoni, the Senior VP for Communications here at Mount Sinai South Nassau. Welcome back again to our Facebook Live audience. We're here today outside of the hospital, outside of Mount Sinai South Nassau. We're in front of what we're now calling our thank you fence. And this is where people in the community just spontaneously have put up signs to thank our healthcare workers here at Mount Sinai South Nassau. And we want to thank you for all that you're doing for the hospital. We've been getting a ton of food donations and all kinds of support. We really appreciate that. It really keeps our frontline workers going here at the hospital. It's terrific for morale. I did want to talk real briefly before we get to the meat of today, which will be about our programs that we're involved in terms of plasma donations and antibody testing. That's what we're going to be talking about today. But before we get to that, just real quickly, because I know people in the community are still looking to help, and we appreciate that. First of all, this is a very long fence. If you're home with your kids and you want to make some more signs for our fence, we'd love to see this fence filled up. That's one way. Also, the expenses of the COVID pandemic are tremendous on our hospital and all hospitals, and like many hospitals, we've started a COVID fund. So if you're in a position to donate to the COVID fund, one example, our personal protective equipment that our frontline workers desperately need, these isolation gowns are now in short supply. This N95 mask, which has been much talked about, used to sell for about 52 cents. It's now between $5 and $7 for one of these. So our expenses have gone way up. If you want to help us, please consider donating to the COVID Relief Fund at southnassau.org/donate. So here it is right there. Just hold it up for a minute. Very good. So, Mark, you want to take this too? Thank you. So, again, we're here today with Dr. Erin Glatt, who's the chair of our Department of Medicine and also our chief epidemiologist here at Mount Sinai South Nassau. And we're also here with Dr. Rob Sharma. Dr. Sharma is our chief medical officer at Mount Sinai South Nassau. Both of these men have been on the very front lines of this pandemic since the very beginning, and we're delighted that they're able to take a few moments with us here today. Dr. Glatt, while we're talking about how people can help and donations, one of the topics now that is very much in the news is plasma donations. If you've already been tested positive for COVID-19 and you want to consider donating your plasma, we're doing that in Hewlett. Could you talk a little bit about why we're doing that and what our hopes are for that treatment?
Sure. So this is a very important new innovative technology that actually is built upon a very old technology. And that is that if a person gets an illness, they get over that illness, they develop antibodies. That's basically your body's way of fighting that virus or bacterial infection that you may have had. And the thought is that you can take those antibodies from a person who is recovered, who's convalescing, and withdraw those antibodies and give them to a person who unfortunately is now being attacked by this virus, by COVID-19 specifically in our case, and hopefully we can give them what we call passive immunity. We take somebody else's good immune blood and we transfuse it into a person who has not yet gotten their own antibodies and is unfortunately suffering the ravages of COVID-19. And this hyperimmune gamma globulin or plasma therapy can hopefully be very, very helpful. There are some very preliminary papers suggesting that it is efficacious, again, very preliminary. And we have done some of those treatments over here already as well. But the idea at this point in time is we need to gather a lot of people who have this antibody in them, because many, many people have, thank God, gotten COVID and gotten better. And their body is basically a factory of this antibody, and we need to be able to identify those people, which is why we're doing antibody testing, and then selecting those patients that have the highest level of antibody and infusing that into patients who are very sick. So what we're doing in a number of different locations throughout the Mount Sinai system, but specifically in this neck of the woods at Mount Sinai of the 5 towns, or Mount Sinai in Hewlett, if you have had a positive COVID test, at the beginning we want to make sure that we're doing the most likely patients to have antibody. So we want to have patients that definitively had a diagnosis of COVID, not just a suspected diagnosis of COVID. We want to take those patients when they're about 3 weeks out from the onset of their symptoms. That's when they'll have the highest likelihood of having antibody present. And we go and test those patients to see what their antibody is. Mount Sinai has a wonderful FDA-approved test which not only tells you positive or negative, but actually quantifies what is the level of antibody that you have. And we actually use a cutoff of 1 to 320, which is a technical number. Anybody that has more than that number or more than that number is teeming with this antibody. They go then to the New York Blood Center. Is that
the so-called titer score?
Yes, that would be what we call a titer. And the people that have these very high levels, and we've seen so far that probably around 80 to 90% of the people who do have the antibody will have this, in fact, very high titer. They then go to the New York Blood Center, which does, through basically a simple blood donation, can take out that antibody. There's essentially no risk to the people. You still have plenty of antibody left. You're not going to suddenly become susceptible to COVID. You're not going to get sick and be susceptible to other illnesses. But that plasma that they take out from you can be infused into a patient who is deathly ill or is going to become deathly ill, and hopefully have a very positive impact on how that patient will do. So this is a critically important, innovative new therapy that we've only had, I would say, within the last 2 weeks, the ability to do this, and we have been using it wherever we possibly can. We are limited by the amount of plasma that we have from the community. Now at Mount Sinai Hewlett, they've been, thank God, inundated with requests from people who meet these criteria, and it does take a while to get everybody tested and to get those results to the New York Blood Center and have the New York Blood Center call you back and arrange for the person, if they're willing, to be a donor. So there are a lot of steps, and since it's so new, it's not as smooth as we all would like it to be, that you walk in, you get tested, you get your level that day, and you donate that day. Maybe in a few weeks it will become as simple as that, I don't know. But right now it still does take a little bit of time. But every person who had a positive COVID test, they're welcome to come and go online to our Mount Sinai Hewlett location and see the form that you have to fill out. If you had 3 weeks ago the start of symptoms and a positive test, you might be an eligible donor. There are other places you can donate as well. All of the pooled plasma goes to the New York Blood Center. None of it is directed towards an individual. It's not specific for a hospital. But then all the hospitals that are capable of doing this are then going to have enough of the plasma of this hyperimmune globulin to go and infuse in patients. And we hope that this will be a very successful form of therapy. There's some preliminary evidence that it is, but again, it's still very preliminary.
But we do want as many donors as possible, right? Even
Absolutely.
Though it's not as smooth a process as we would like, please don't let that deter you.
Right. And people shouldn't be upset if they don't get their information right away, if they don't get a call back 5 minutes after they submitted it online. It will take a little bit of time, but guaranteed you will get a call back. And you will, hopefully, if you test positive, then be able to be a donor, and the New York Blood Center will call you again at the earliest possible time. The most important thing is to get as many people who are good donors to actually go and donate, so we can then give it to more patients who are in desperate need of it.
This is potentially life-saving.
Absolutely. Yeah. Absolutely.
So let me turn to Dr. Sharma, who's our Chief Medical Officer here at Mount Sinai, South Nassau. Because I know, Dr. Sharma, you've been directly involved, as have Dr. Glatt, in actually treating COVID patients here and monitoring them. We have, for the first time that I'm aware of in a few days, we have below, I believe, 300 COVID positive or suspected patients in the house, which is significant. But tell us about some of the patients who have received the plasma treatment. It's probably anecdotal. I'm not sure if that's the right word, but tell us what you've seen.
Certainly. So anecdotal is the correct word. As Dr. Glatt mentioned, Mount Sinai has the antibody test under an emergency use authorization from the FDA, and they were able to create the plasma with the New York Blood Center. It is an investigational use of this plasma, so it's not a FDA-approved treatment, and patients are enrolled in a study when they receive it. As we are getting more and more donors, we are getting more and more plasma made available, but you mentioned we have 300 patients. We typically get 1 or 2 units of plasma a day. So clearly we have to be very judicious in how we use it and make sure patients meet the enrollment criteria for the study. They have to also consent to the study also, so that they will partake as a patient. We've given it to about 15 patients so far. Ideally, we try to give it to patients before they get on a ventilator. We've heard a lot of talk about ventilators recently, and we try to keep them from needing a ventilator. And we've had some good success stories. We even had one patient discharge who got plasma within a couple of days of getting plasma. And we've had other patients who were looking like they were heading south, making a good improvements. Of course, as you mentioned,
after they received the
plasma. So, of course, you mentioned this is anecdotal. This is not research at this point in terms of published data that we could say definitively that it's working, but it is very promising therapy, and we're encouraged by the results so far. And we certainly would encourage as many donors as possible to make this available to all of our patients.
So let me follow up in terms of what this might mean, the antibody testing, and Dr. Glatt, feel free to chime in here as well. So this is what we're talking about so far is very specific plasma donations as a treatment, potential treatment for COVID patients. But what does the antibody testing possibly mean for the larger population? And also just give us an update on we hear and see that the hospitalization rates are slowing down. That's happening here as well. Are we at a plateau? Are we on the other side of the mountain?
Great question. So we'll start with the first one. Most diseases, as Dr. Glatt mentioned, our immune system fights and we form antibodies as a result of that exposure. Before we had the vaccine, chickenpox would be a good example where we could measure antibodies and know whether you had gotten exposed to chickenpox as a child. And you don't get chickenpox again typically once you have antibodies. So the assumption is coronavirus is not that different in our expectation that if our body makes antibodies and there's enough of them, that person would then be theoretically immune to getting coronavirus again in that immediate period. We don't know how long that would last, whether it's 3 months, 3 years, 30 years, we don't know. So the good news is that for those patients who were recovered, that statistically they're going to be protected from a reinfection, at least in that short-term period. And what that means in terms of the pause, which we all heard Governor Cuomo extended the pause, is that as we find out which individuals have this hyperimmune response, we would be able to suggest that they may be the ones who can be safely in the environment without worrying about catching COVID or transmitting COVID. The challenge there is we don't know all the science on that yet. And it is possible for somebody to have COVID and not be infected, but still be infectious to other people. So we're still learning a lot about the disease every day. As you mentioned about the plateau, we saw a huge spike last week. And we had at that point over 500 patients earlier this week on Monday. And what we've seen now being Friday is that the patient numbers have been steadily declining. And so yes, I think we are at a plateau and a downward plateau at that. So that's good news. We can't take our foot off the accelerator. I think Governor Cuomo did the right thing by extending the pause, because this is the time period where we actually can benefit from all the hard work that everybody's put in social distancing, all of the challenges that's associated with that, and the isolation that people have had to endure. If we take the foot off the accelerator now, we might see that spike and be back to 500 patients in the hospital again. Today we are at 400 patients, so we normally have around 330 patients, so we still certainly hospital.
That's total census.
That's total census,
right,
yes.
Right.
And over about 300 COVID and COVID suspected. Right. So it's important that people don't rush out, don't do things and think that, oh, things are getting better, we can break the social distancing strategy. I think it's more important than ever for us to maintain it and get rid of this virus. The best way to defeat this virus is to stop its spread And right now, the main vector for the virus, the main carrier, are humans. And so if we can stop it from going from human to human, it'll burn itself out, and we can go back to some normalcy.
So let me turn to Dr. Glatt on this next question, because a lot of people, it is getting tough. We've been home isolating for weeks now. The schools are out. We're starting to hear, boy, the numbers are getting better. Let's go out and have spring, nice spring. Just talk a little bit about why that is so dangerous. And also, could you address a little bit in terms of the testing for the overall population? Are we going to get to a point where we're going to be able to do antibody testing, not just for healthcare workers and for those who want to donate plasma, but for the broader population?
Okay. So I'll answer your first question first. Reiterate what Dr. Sharma said. If we do not continue maximizing social distancing, we will unfortunately go right back to where we were a week ago. And people don't realize how close to the precipice all the regional hospitals were in terms of collapsing. We could not have tolerated a significant additional number of patients when we reached our 150% of maximum. When we go to 500 patients, we had patients in tents. We had patients in areas that normally are not clinically used. We had staff that was stretched. And if we have to go back to that, I can't guarantee that we'll be as successful as we were last week, which was an unbelievable testament to the staff at the hospital that they went well above and beyond what is necessary to maintain a hospital of 500 patients. And therefore, everyone has to realize that as difficult as it is to somewhat stay in the social distancing mode, we must do that, or else all it will have done is push things ahead a week or two or three till we get to the point where the system collapses. So we must, I can't stress this any more than we are, we must maintain social distancing. We have to make sure we don't relapse into the past the way we were until we clear this totally from the population. And when will we do that? That will a lot depend on the second part of your question, Joe. And that is, what does an antibody test actually mean? When will we start rolling it out? So at the present time, we're building the capacity to start testing a lot more people. This is a very complex test, but it needs to get rolled out in a much greater fashion. And part of the difficulties in controlling COVID has been the lack of a very easy available diagnostic test and the lack of now a easily available way to prove that somebody is immune. Now, we do not know what the immune test results mean right now. Based upon the best knowledge that we have, we think that a person who has antibody cannot get COVID again. There are some disturbing reports that suggest that that may not be 100% true. I think there are reasons to explain that those are incorrect. But until we can guarantee that an antibody test really proves that you're immune, people cannot just say, well, I'm immune, I can do whatever I want. Even when we do get to that point, we'll have to roll out proper testing in the community. And so people who are truly immune might be able to go back in a somewhat normal way to work, to socializing. But we are not at that point yet. I don't think we'll be there for another month.
Do you think that we will get to the point, though, of widespread testing for not just healthcare workers and plasma donors, but where anyone who wants it will be tested? And
so my, at this point, guess, and that's what it is, a guess, but I think it's a good guess, is that yes, we will reach that point. And when we have an easily available antibody test that can either be what we call a rapid test, so you get a test that says yes or no, or we get a more definitive test, a quantitative test that says this is your titer, and people with this titer, we feel very comfortable saying you're immune. When we get that in a relatively short period of time, and we have the ability to enroll many, many patients in this type of a testing, we can get a sense of what percentage of the population is actually immune, if that is correct. And then that immune population could theoretically, again, theoretically, not have to socially distance as much. However, all of those are unknown at this
Not
point
there
in
yet.
time.
We're not there yet. Not there yet. Okay. Dr. Sharma, we do have some questions from our Facebook audience, and please, you can keep sending them in. We always appreciate to get some feedback and some questions from our audience. So this is one question we have. If I'm a healthcare worker and I want to be tested, what should I do?
So for healthcare workers at South Nassau, Mount Sinai South Nassau, they just have to call Employee Health and schedule an appointment, and we'll take care of that. Most healthcare workers can do the same within their systems if they have that available. And certainly if you're outside of South Nassau and you're a healthcare worker, you can go to Hewlett and be a donor just like any other member of the community can donate. Before we get to the next question, I did want to remind people that the governor also issued an order that masks are going to be required in public. I think that's an excellent order. One of the ways other countries were really able to curb the spread of the disease is that it was much more culturally acceptable to wear masks, and very early on people were wearing masks. We were behind the curve a little bit, and we've gotten away from handshakes, and now we're wearing masks. I think this is going to be the new normal for quite a few months, so we should expect to see that, and hopefully that will help curb the coronavirus spread even further.
So just back to testing, because I have another question on that from one of our Facebook audience members. There is still no widespread, if you don't have any symptoms, there's still no widespread COVID testing right now.
Correct. We are not at the point, as Dr. Glatt mentioned, we don't have widespread testing for either COVID or for antibodies, and we are working towards getting there. And as we get closer to that, we'll have more information available, and hopefully quickly to the public, so they know what to do for themselves and their loved ones.
So this is a question from an audience.
Go ahead, one thing to that. I think it's very important. There are a number of tests out there that have not been proven yet that they're truly effective. There have been false positives and false negatives, which means that the result that you get may not really be correct. And that would be very dangerous if people mistakenly are told by some of these tests that are out there that yes, you are immune, or no, you're not immune, and those tests are wrong. That could lead to a lot of difficult personal medical problems as well as societal medical problems. So I caution, there are a lot of tests that have gotten very, very quick approval, but now we have to work backwards and see, do they really work? Are they accurate? And until we know that, I would not recommend that any clinical decision be based upon some of these very unproven antibody tests, as opposed to the test that Mount Sinai is doing, which is a definitive quantitative test. It tells you how much your titer is. That test has been proven to be accurate. So you have to be very careful what test you're getting and to take the results with a tremendous grain of salt.
All right, so I got one question for Dr. Glatt, one question for Dr. Sharma. This is for Dr. Glatt. So what if I'm in close contact with someone who has tested positive? Do I need to get tested?
Tested positive for COVID or for the antibody?
For COVID.
So if you're exposed to somebody who has contagious COVID, they tested positive, that's presumptive that they're contagious, infectious, so then you should be in self-quarantine, not just maximal social distancing. You shouldn't be going out in public. You shouldn't be going out for food. You shouldn't be going out for any reason. You are a person who is at high risk of having asymptomatic and then symptomatic illness, and you could be a super spreader. You could be a person that could spread disease to many, many people without knowing it.
Without even knowing it.
Right. So it's critically important that those people self-quarantine, which is different than the maximal social distancing. There's two categories. Everybody should maximally socially distance, because even if you had it, you still could be contagious, even though you feel better. But the people that don't yet have it and have been exposed, they could potentially be spreading in every contact that they come with, while they're totally asymptomatic, without any symptoms, to everybody that they come in contact with. And that's how the disease took off so rapidly. About 10 to 20% of people fall into that group, that they have no symptoms and yet they're spreading. So therefore, we must be careful about that.
All right, Dr. Sharma, you mentioned the governor's order, which I believe becomes effective today.
That's
to
correct.
Wear masks in public. You're going to the grocery store. You're going anywhere.
Right.
Especially if you're not going to be 6 feet apart, you got to wear a mask by law. What type of mask do you recommend?
So the easiest mask to get, generally is still available, is surgical mask, and that's the best mask to wear if you can get it. Obviously, we wear N95s in the hospital. That's because we are in highly dense COVID areas where we are exposing ourselves and our staff to COVID. So the N95 is recommended in that scenario. If you don't have a mask, so they're still hard to get masks no matter what mask you're talking about, but if you don't have a mask, even a bandana can be helpful. It's not nearly as helpful as a mask, and the mask serves two functions. One is if I have COVID and I'm unaware and I'm spreading it through my speech or cough or sneezing, the mask contains a lot of that. Not all of it, but a lot of it. The second is if I'm in a space that has COVID, when I breathe, surgical masks have been shown to be about 60 to 80% effective. If you take an N95, the 95 stands for 95% effective. Surgical masks are around 60 to 80% effective in one study. So if you can get a surgical mask, that's the best one. The bandana, at the very least, what it will do is if you have COVID and you don't know it, it will reduce the amount of spread. It won't be as effective as protecting you from COVID. So the ideal thing to wear is a surgical mask if you can get it. If you can't get it, then a bandana or any other kind of face mask is helpful.
So something is better than nothing.
Correct.
Is the message here.
Yes.
Okay, well, very good. I think that's just about it. We're wrapping up. Any other last thoughts from Dr. Glatt or Dr. Sharma?
Just restate social distancing, social distancing, social distancing.
Don't give up. Keep your foot on the pedal. We need to continue to fight this virus. Thank you very much for joining us here at Mount Sinai, South Nassau.